We just want to talk about liposonic. And the first question is how liposonic works.
Right. So the liposonics treatment is a high intensity ultrasound laser that basically targets fat tissue and destroys fat tissue non-invasively. So without surgery and without liposuction.
¿Qué me quieren decir?
No, que el movimiento de las manos, que pueden
Okay.
ser algo de.
Oh, okay,
El
just.
tuyo, el tuyo.
Oh, my. Oh,
Sí.
it's my hands. Okay. ¿Queremos repetir esa de nuevo?
No,
o
está
está
bien, está
bien?
bien. Dale.
Okay, beautiful. So, can you explain us exactly what the procedures consist on?
Right. So the liposonics treatment consists of a machine, a laser that we use on certain areas of the body that the patient is trying to reduce 1 to 3 inches of body fat. So for instance, a woman who just had a baby a few months ago or a couple years ago has that extra 2 inches of fat on the stomach she just can't get rid of because, despite exercise and a great diet. So we target that area, and the treatment goes on for about 30 minutes to an hour, depending upon what area is being treated. And over the next 8 to 12 weeks, the body naturally absorbs all that destroyed fat tissue, and you start to lose inches.
Does it hurt?
There is some minor discomfort involved, but we do give pre-pain medication before the procedure, so most patients tolerate it fine.
So we're talking, I just want to know a bit more about the technology that is behind this. What is it? Is it a laser? What is this about?
So the liposonics treatment is a type of ultrasound laser. So most of us are familiar with ultrasound, when they look at it, when they're looking at your baby or something like that. But this is kind of a targeted ultrasound laser that goes to the fat tissue underneath the skin and destroys those fat cells. And then your body naturally over the next 1 to 3 months absorbs those killed fat cells and eliminates it, just like we eliminate everything through the kidneys and the liver naturally.
So approximately how many inches can I lose with this procedure?
So with one treatment, you can lose up to 3 inches, depending upon the body area that's being treated. Now, some people, I gotta think of a word, hold on. Okay. The latest thing about the latest improvement in Fraxel technology with this Fraxel dual laser that we have is that we can now treat patients of all skin types and all skin colors, which in the past was not true. So the great thing is that patients of darker skin tones can now come in and have their wrinkles treated, their acne scars treated without fear of side effects.
Is this an FDA approved treatment?
Fraxel has been FDA approved. The Fraxel laser has been FDA approved for many years and has been used in this country for over a decade.
Why is it important to make this procedure in a professional environment and ask for professional help if you're interested?
The Fraxel laser is, The Fraxel laser is an advanced technology and should be only performed by board-certified dermatologists and plastic surgeons. So if you're interested in the Fraxel laser, please call your board-certified dermatologist and make an appointment.
Did we miss anything?
Let me think. Talked about stretch marks, which is really important. Oh, yes. Okay.
Side effects?
Doctor, tell me about downtime and side effects.
So doctor, let's talk about side effects and downtime with the procedure.
Because the Fraxel laser is a non-ablative laser, there's very minimal downtime involved with the procedures. In fact, I tell patients that they can go back to their normal activities the next day. Some patients will choose for their first Fraxel treatment to do their first procedure on a Thursday or Friday so that they have the weekend to recover. However, I've seen that most patients say that they actually didn't really need the weekend to recover, but just wanted to be on the safe side. Now, as far as side effects go, just like any technology, the Fraxel laser can have some side effects, which are normal with the procedure. For instance, you'll have some mild redness in many patients for a couple days, but for most patients that only lasts about 24 hours if it happens. And when we're removing sunspots and brown marks, you will have some flaking, usually on the 3rd day, as those brown marks and sunspots are flaked off of your face.
When you're doing this kind of procedure, are there precautions that people must take while they're under the treatment? Like, for example, sunblock and stuff like that, or avoid the sun? What goes behind that?
When I see a patient for a consultation about the Fraxel Laser, I tell them that yes, this procedure, when we're doing this procedure, you should be more careful with the sun. However, I do the procedure during the summer and spring months. However, patients are told to be more careful with the sun as far as avoidance, using physical protection such as hats, and of course using sunscreen every 2 hours when they're out in direct sunlight.
So, Doctor, approximately how many inches can we lose with this procedure?
So with the liposonics procedure, you can lose up to 3 inches in one treatment. So we often say if you have an inch to pinch, then you're a good candidate for this procedure. Now, for people who are, very overweight or obese, we would certainly recommend losing weight before getting this procedure done. But for people who would, before have to go get liposuction for areas that they just couldn't get rid of, a few inches, this would be the perfect procedure for them.
Beautiful, and exactly that's what we want to talk about right now. Is those are small sections, like the fat located in the lower abdomen. Can we treat those with liposonics?
So the great thing about the liposonics treatment is that we can treat multiple areas of the body where you have inches of fat that you can't get rid of. So one is, of course, the lower abdomen, the flanks, otherwise known as the saddlebags around the, wait, let me start again with that. Okay. So the great thing about the liposonics treatment is that you can treat multiple areas on the body. For instance, the lower abdomen, upper abdomen, love handles or flanks, so we definitely treat men and women. Some of the saddlebags that especially women have on their hips or their thighs. And another great area is the arms. So a lot of people who have, extra fat, especially on their upper arms, who they couldn't get rid of, this is another great area that we can treat with the liposonics treatment.
Yay! Okay, so is it true that this works with no surgery and no anesthesia?
So it is true that the liposonics treatment, it works, let me start again. So the liposonics treatment, let me start again. So the liposonics procedure is without any surgery and without any cutting. So with liposuction, of course, we would have to use a cannula, which is the instrument that we have to go through the skin and to suck out the fat. With this, the machine is just above the skin, so there's no cutting or surgery involved whatsoever.
Beautiful. So we already went about how many sections, but patients will start looking at results?
So with the liposonics treatment, you will start to see results in terms of losing some inches within a month. So we actually have patients come in a month to start taking measurements. The full results, though, take 3 months, and that's only because it takes that long of a time for the body to fully absorb all the fat that's been destroyed. But you will start to see an improvement even within a month.
Could you see bruising with this procedure?
You can see some mild bruising. Most patients report that it only lasts about 5 to 7 days, if any. So it's very mild and goes away very quickly.
Beautiful. No compression garments?
No.
Okay. Okay, so Dr. Nichols, can we use this? Oh yeah, you already answered that question, if it can be used for one section, more than one section.
Multiple
So we
areas,
have
right.
That one. Oh man, can men use this procedure also?
The great thing about the liposonics treatment is that it's great for men to use too. So, a problem area for a lot of men are those love handles that, despite diet and exercise, especially as men get older, they just can't seem to get rid of. So this is a really nice, non-invasive way for them to get rid of those love handles and not have to have surgery.
So who are the perfect candidates to have this procedure? What age range and what kind of people can get it?
So the perfect candidate for the liposonics treatment is somebody who has 1 to 3 inches to lose within one treatment. These patients can range in age. I've had patients as young as, 20 to up to 70. So the age range is vast. And you can have additional treatments done. So for instance, if there's someone who maybe has 4 inches to lose, they can get the first treatment done, wait the 3 months, and then we'll do a second treatment to permanently get rid of that last inch or 2 of fat.
And of course, this needs to be performed in a professional environment, right? And it needs to be very safe and clean for everybody.
So the okay, so I'm starting.
And is it approved by the FDA?
Right. So liposonics treatment has been around and researched very fully for the last decade and has been used in Europe, Canada, and Asia for many years and was just FDA approved in the United States in January of 2012. So it's an extremely safe procedure. It's been used for many, many years with fantastic results. So I have one more question for you. Two more questions. No, one more question. Ask me, what was it? Oh, about the, where should it be, where should I go if I'm interested in liposonics treatment? Where should I go to get more information or something like that? Because then we can say, yeah.
And doctor, for more information, where should I go if I'm interested in getting this treatment done?
Because the liposonics treatment is in high intensity laser ultrasound, I do recommend that you only have it done by a board certified dermatologist. So if you have questions or you're interested in liposonics, please call and see a board dermatologist. Okay. Should I start again? Okay. Okay. The liposonics treatment is a high intensity ultrasound treatment. So it should be performed only by a board certified dermatologist. So if you're interested in liposonics treatment or you want to get more information, please call a board certified dermatologist like myself and we'll talk to you more about the procedure and hopefully get it done.